Vergara of the World Languages and Cultures Department, and it's called Meeting the Need for Health Education within the Hispanic Community of Trenton. I'm really excited to share with you what I did today. So my objectives in doing this independent study were to deliver health education, but the health education needed to be very specific to the audience that I was going to be presenting to. It was obviously I wanted to focus on the Hispanic community of Trenton, so I needed to take into account where they were coming from, their socioeconomic status, their levels of their varying levels of literacy, and I also needed to understand what areas the Hispanic community of Trenton most desired and needed to be educated in. So to do that, I had to conduct research on broad and on local scales as well. This turned out to be a huge exercise in practicing cultural competency, which is a concept that we use in nursing that basically says that when you give care, or education in this case, you need to take into account a person's whole identity, who they are, their gender, their race, their age, their past experiences, etc. And obviously this was, because I was presenting to the Hispanic community of Trenton, this was a huge opportunity to utilize and practice my Spanish speaking skills. So like I said, I conducted research on broad and local levels in order to best understand what areas the community needed to be educated on. So on a broad scale, I utilized reports from the Trenton Health Team, which is a collaborative in Trenton, which is a health collaborative in Trenton, with the goal of making Trenton the healthiest city in New Jersey. In 2016, they released a community health needs assessment, which proved to be really instrumental in understanding where the community needed to be educated the most. I also utilized reports from the Centers for Disease Control and Prevention. They have a program and a service called Teen VaxView, which gives data on vaccine coverage for the various different vaccines that are necessary for teens aged 13 to 17. They have data regarding vaccine coverage and how that vaccine coverage changes depending on a person's age, their poverty level, where they live, and what their race is. So these agencies provided me with a lot of information that helped me narrow down where I needed to educate the most. And then on a local scale, I collaborated with Dr. Tracy Perrin from the School of Nursing, and I worked with her in her program, which is called the Smart Nutrition and Conditioning Program for Kids. And that was created in 2016 with the intent of addressing the very high rates of childhood obesity in various Trenton elementary schools that have higher Hispanic populations as compared with other schools in Trenton that have more African American populations, and it was found that these schools in Trenton with higher Hispanic populations have really high rates of obesity. So Dr. Perrin and other faculty and other nursing faculty created the SNAP program, that's what it's called, to address and intervene in this case. So I helped Dr. Perrin with her research there, and what I did was I conducted interviews with Spanish-speaking mothers of elementary school students in order to understand what their diet and exercise patterns were within the home. And then I interviewed Caitlin Gregory, who is the Legal Services Coordinator for a nonprofit in Trenton called the Latin American Legal Defense and Education Fund, LALDEF. And I interviewed her in February to understand what kind of resources were available in the community that could help, that could provide further resources and aid to people within the community specific to their needs. And she demonstrated a very deep understanding of the needs of the community, their practices, their beliefs, and she made a very telling comment at one point when I had asked her if she knew of any nutritional educational programs that were available within Trenton. And she made a comment after that, and she was basically saying that the people she's working with, the Hispanic community that she's working with, hi, thank you for coming, the Hispanic community with which she works isn't really focused on nutrition, on the nutritional value of their food. They're more focused on just gaining access to food. So this tells me that food insecurity is an issue within the Hispanic community of Trenton, and it's also telling me that a lot of these people are working hard to feed their families, but they just don't have the resources they need. So all of this research demonstrated to me various things. On a broad scale, it demonstrated that the reports from the Trenton Health Team demonstrated to me that the Hispanic community of Trenton needs and wants preventative education with regard to obesity, mental health, and chronic illnesses. And the reports from the CDC showed me that Hispanic teens in particular are not completing their vaccination schedules and therefore not receiving full immunity against various diseases. And they overall have lower rates of vaccination compared with Caucasian non-Hispanic teens. And that was across the board. That was across the board with regard to the various different vaccines. So, for example, meningitis and the human papilloma virus they're given on various schedules, various doses, and even if the Hispanic population is completing those doses, there's like a smaller percentage of them are receiving the full vaccine, the full vaccination as compared with Caucasian non-Hispanic teens. And then research on a local scale, the interviews with Hispanic mothers in Trenton showed me that the Hispanic community in Trenton really values cooking their own food and they rarely eat out. And the mothers especially, it was all mothers at these snack community cafes. It was all mothers and they were all monolingual Spanish speakers, so it gave me a great opportunity to practice my Spanish skills. They go through great efforts to save money when they go food shopping. One mother in particular shared with me that she goes food shopping at 3 different stores in order to save the most amount of money that she can. And again, Caitlin Gregory's comment to me and then the experiences of the Spanish mothers that I interviewed demonstrated that access to food continues to be a challenge for this population. So in order to meet the need for health education within the community, I worked with Professor Jimenez Vergara to develop and deliver these 3 health educational workshops. And I delivered these workshops to students of the Futuro program, which is a mentorship program managed by LALDEF. And in order for someone to be a Futuro student, they need to be a college-bound high school senior living in either Princeton or Trenton. They need to be Hispanic of the first or the students that I work with were Hispanic, but the requirement, there's no race requirement, it's just that they need to be first or second generation immigrants. The students themselves were mostly bilingual, although some of them preferred English over Spanish. And Professor Jimenez Vergara shared with me that there are varying legal statuses within the student body. Some of them are citizens, others are completely undocumented. As well as that, there are varying insurance statuses with varying health insurance statuses within the family. Some of them don't, most of them don't have health insurance. And then I presented 2 workshops to the students, and I presented 1 workshop to the parents of the students, and the parents had varying levels of literacy, and they were mostly monolingual. So I presented all of the workshops in Spanish, but with the parents, I could not rely on English speaking skills at all. It had to be completely in Spanish. So my first workshop was to the students, and it was in March. And we covered education that was specific to their age group and their requirements as college-bound seniors, and met the educational needs that were relevant in the broad-scale research and the local-scale research, because nutritional education is preventative education that works against that prevents obesity and chronic illness. So we started talking about vaccines. We started talking about the different vaccines that were necessary, especially the meningitis vaccine, which is necessary to live in a college dorm. And we talked about sites within the community that gave vaccines and accepted patients of varying insurance status. And then we went into nutrition, and nutrition was important because these kids, being away from home for the first time, need to know how to make healthy choices with this newfound independence they have with respect to food. So in order to do that, we reviewed the My Plate graphics so they know how the different food groups should be distributed on a plate. And then we did an activity in which we practiced reading a nutrition label. So in order to do that, I talked first with them how to read a nutrition label. And then I compiled these different nutrition labels, and I had the students break out into groups and then choose each nutrition label choose 1 nutrition label from each pair. And they had to make a decision as to which one was healthier without knowing what the label represented.
Good idea.
Thank you. Yeah, it was great. And then after that, I showed them each question and which food was represented by each label. And the purpose of this activity was to show them that they don't need to give up eating the things they enjoy. They just need to understand the information that comes from a nutrition label and how that affects them, and how to modify their diets and not change them completely. And then at the end of this workshop, we created a word cloud. I had all of the students, I used a service by poll everywhere, to create this word cloud in which all of the students volunteered words that came to mind when they thought about coming to college for the first time. So this was just nice and tied it all up at the end of the presentation. I had my second and last workshop for the student was on April 17th, and this was to talk specifically about mental health, behavioral health being cited as a concern within the community by the community health needs assessment put forth by the Trenton health team. So we talked about the changes in the stressors that accompany the first year of university and how these stressors can create the symptoms of mental illness. We talked about what those symptoms are, how to recognize them, and then we talked about what the students can do if they or someone they know are experiencing symptoms of mental illnesses. So we talked about the counseling services that are usually provided by the universities, and then we talked about methods of self-managing stress, that being exercising and meditation. And then I had my good friend Ellen Rebeck, she's a yoga teacher, come to LULDEF that day and lead us in a very short yoga class. And the purpose of that was to allow the students to practice what they had just learned. My last workshop was on April 27th, and it was to the parents of the futuro students. And as I mentioned, this one had to be completely in Spanish. I couldn't rely on my English speaking skills at all. So I started talking about vaccines in order so that the parents could have the same information as their students did. We talked about the different vaccine schedules and the sites within the community that gave vaccines to patients of varying insurance statuses. And then we also went into nutrition. And the purpose of talking about nutrition was to show the parents that in order to cook healthy food in the home, it's not necessary to change their diet, to change their culture. Because as Professor Jimenez Vergara once said to me, Hispanic families preserve their culture in America through food and through their language. So I didn't want to send the message that their food and their way of life needed to be changed. Rather, I wanted to show them that they could modify what they were already doing in order to improve the nutritional quality of their food without changing it completely. So we went over how to read a nutrition label, and then we did a group activity called Replace Not Redefine. And in Replace Not Redefine, I gave these very broad suggestions to the parents as to how to improve the nutritional quality of their cooking, such as cooking with healthy fats, including fiber in their cooking, and then substituting out salt for other seasonings. So I had the parents break out into groups, and I mounted these sheets onto pieces of paper, and then the parents within their groups talked about things they were already doing that adhered to these suggestions and discussed ways they could implement these suggestions into their cooking. And as Professor Jimenez Vergara mentioned to me, the parents were of varying literacy statuses, so it was important for me to include lots of recognizable foods and name brands in the suggestions that I had given.
You are very talented.
Thank you very much. Lots of help was given to me, so this is not a one-man show by any means. So I think overall, the students perceived the information in the workshops as very positive and useful. I had students coming up to me at the end of one presentation disclosing to me their health problems, their legal status, and that showed to me that they really trusted me and saw me as a viable source of information. One student at the end of the mental health presentation came up to me and said, "This was a great presentation. So many people talk about the changes that we're going to experience in college, but no one talks about how those changes are going to affect us." And the parents seemed grateful for the information that I gave them, but they anticipated difficulty in implementing the suggestions. One father at the end of the presentation shared with me that while all this information was great, he comes from a place where people don't have the resources to implement suggestions like this, and that people often opt for the unhealthier option in their community because it feeds their family. It's cheaper. And even though they know it's not the healthier option, they opt for it because they at the end of the day, they just want to see their family fed. In the future, in improving health educational workshops like this, I would suggest implementing a post-survey that would further gauge how useful the audience found the information and how soon they anticipated implementing what they had learned. And then I would, kind of going off of the comment that parent made at the end of the parents' workshop, I would do further research on resources within the community that would facilitate parents implementing the suggestions that I had made. The biggest takeaway that I took from this whole independent study was that cultural competency is one of the most important things that you can implement in your care. Because if you don't have cultural competency, the information, even if you have the best information and the best research in the world, if it's not presented in a culturally competent way, people aren't going to take it. So you need to meet people and patients where they are, and that's the best way that you can reach them and help improve the overall health of any population that you work. I would like to thank with all my heart Professor Jimenez Vergara for working on then Caitlin Gregory and the whole Law Left team for supporting me. All my heart goes out to the Futuro students and their parents who work so hard to get them where they are. Professor Rachel Adler, who's not here today, but she's a professor in the sociology department who really helped me organize my paper and this presentation. And special thank you to my mom and my dad and my friends.
I want to add a couple of things here that we didn't mention, but I want everybody to know that she did look for resources for the students and the families, even though she says that I will look for more information. I think you gave them enough for them, and they were very thankful. Many of them contacted me after.
Oh.
And there is one student that was going to study film. After her presentation, he decided to change. He is going to be a nutritionist. And thank you so much, because we were concerned about that student. And he found something that he really liked, but he didn't know how to approach. And thank you for being that person to make that change. So it was
Any questions?
I just want to make a comment. I was just so impressed with your
Thank you.
maturity and insight and ability and presentational skills
Thank you
and
so much.
caring.
Thank you for coming.
It's so cool.
Thank you so much.
it was a pleasure to work with you.
It was a pleasure to work with you.
It was incredible. She started in November with some questions, and then I say, oh, why is that you don't come to LADEF, and then we'll do some workshops. And I thought it was one workshop. It ended up being 3.
Wow.
She came also with the students to a concert, spent the entire day practically with them. So she gave more than I was expecting.
Thank
I'm
you.
very, very pleased to have somebody from TCNJ showing such an incredible work
Thank
in
you
the
so much.
community.
Thank you.
Amazing.
Thank you.
So, I teach I'll be teaching the medical Spanish course
Oh.
in the spring
Oh,
again.
exciting.
So I've been wanting to do this kind of stuff, and I can see all these possibilities because we have done work like that. There's always a 300 level cohort of people, and so if you, I know this, I'm putting you on the spot because you haven't had a chance to think about it, but if you were to like do follow-up, like what would be the next thing to do? Like repeat something similar again with the tutor cohort, another group? I mean, what do you think?
Follow up in one respect.
In terms of like what you did, I mean, it's obviously this semester, like we would repeat it again maybe next year.
Okay.
And it would be the medical the people in the 219 class, because there'll be a group that's in 319.
Okay.
So there'll be 219 people, and then what we call 319, there's only like 4 or 5 that are doing it at higher level.
Mhm.
So they have the Spanish skills that
Yeah.
they do. So you think that, what would you, like if we were to pick up something like this to kind of repeat if we could, what would you advise, or what do you think would be, I mean, you mentioned a lot, but I'm sure there's something else.
I think that my biggest piece of advice would be to know the audience, to know where they're coming from, to know what the physical environment they're living in is. We had to do a windshield survey for one of our nursing assignments, and that gave me so much information. You just drive around the community. When you do that, you gain so much more information than you would anticipate when just driving around. So
What's a windshield survey?
Sorry.
That's just driving around.
Yeah, all you do is you drive around like a specific community, a specific neighborhood. We didn't have a plan of where we were going. We were kind of just like, okay, let's go down North Roldan and see where it takes us. We were kind of studying a specific elementary school, so we drove around. We started there, and then we branched out from there. But we gained so much information just from exploring the neighborhood. So I would say that the most important thing is for them to know who they're talking to, know who they're going to be presenting to, know their audience. And as I said in the presentation, there are so many ways of learning, of gaining that information. you can you can do broad scale research, and then you can also do local scale research. It was just by chance that Dr. Perrin was having these informal interviews at the elementary schools, but that gave me so much information from just those short three, I think I did 3 interviews, 3 separate occasions. But speaking with people within the community and people who knew the community very well, people who were experts on the populations like Professor Jimenez Vergara and also Caitlin Gregory, also provided me with the most valuable information that I used. So I think the most important thing would just be to know the audience and know the population.
Yeah, because we have a whole unit on cultural competency, so that I feel like it's covered, but yeah, getting into the community and finding out who these particular people.
Yes, and that might be the most challenging part, just getting into the community. But if you get students who are willing to do the work and make the effort in order to turn out the best outcome possible, then it's possible.
Yeah, you know from the fall class.
Yes,
It's
I
not
do.
always easy.
Yes, it's not always easy, but LALDEF is so open to people, is so welcoming to people who are willing to come and help. Yeah. Any other questions? Thank you so much for coming.
Okay, grabamos, bueno.